So today I wanted to take a minute to talk about fetal positioning and what that means. So a lot of times when I go to meet with clients towards the end of pregnancy, I'll ask them, do you know what position your baby is in? Has your midwife, has your doctor talked to you about that? And most of the time they'll say, oh, well, at my last check, my baby was head down, which is great. And it is definitely more likely that you will have a successful vaginal delivery, if that's your goal, if your baby is head down versus in a breech position. That being said, head down is not the only position to pay attention to at the end of your pregnancy. We are also looking at whether or not your baby is in an anterior or a posterior position. So what this means is the back of your baby's head facing your front or your back. If you've ever heard anybody say, oh, I had a really hard labor because my baby was OP or my baby was sunny side up, this means that the back of the baby's head was facing the mom's back. And it is not by any means impossible for a baby to be born in this position. It's fairly common, it's a variation of normal, but it can make things a little bit more challenging. It can make labor be a little bit longer, it can make your contraction patterns be a little bit funkier because it takes a lot more effort to get the baby to tuck their chin and make it through the pelvis in a way where they fit versus being in an anterior position where the back of the baby's head is facing your front, in which case most of the time it's easier for babies to move through the pelvis a little bit more smoothly with a little less effort on the part of your uterus. So why is this an issue? Why is this anything that we would talk about? Well, in today's day and age, we spend a lot of time sitting, number one, and sitting in a semi-reclined position, number two. So think about your day. Do you spend time on the couch watching TV at the end of your day? How are you sitting? Are you sitting kind of leaned back, kind of curled up, kind of on your side? But in whichever variation of the way that you're sitting, are you kind of leaning backwards in a seated position? What about in your car when you're driving? Are you sitting straight up with perfect posture, or are you kind of slumped back? Maybe you have a long commute, you're listening to your music, listening to an audiobook, listening to a podcast, and you're trying to relax. And a lot of times the way that we think about a relaxed position is to be in that kind of semi-reclined seated position. And what's happening when we do that and we're pregnant is that gravity is at work and it's pulling the back of the baby's head, the heaviest part of the baby, backwards towards your spine, and that's how they can end up in that posterior position. So if you think about your day, if you're a person that sits a lot at a desk job or any other reason, you might start to realize that this could potentially be a problem for you. So I'm going to give you a couple of tips to help counterbalance that you can use, very easy things that you can use throughout your pregnancy, especially towards the end of your second trimester and into your third trimester, to help give baby what they need in order to move forward and be in that anterior position as they grow and as they settle in and engage for birth. So the first thing that I recommend is chiropractic care. So chiropractic care during pregnancy, it helps balance the pelvis. It helps your alignment be best so that baby can move physiologically into the pelvis in the most comfortable and best way that they can. So that's the number one tip. Chiropractic care during pregnancy is safe for just about everyone. I can't say that in my 6+ years of being a doula I've ever heard of a reason why it wouldn't be indicated. So obviously check with your care provider, check with the chiropractor, but should be safe. And it helps with a lot of other things during pregnancy too. It helps with your comfort. It helps relieve aches and pains. It can help, alleviate issues with sciatic nerve pain or pelvic symphysis disorder and other things that can come up towards the end of pregnancy. So it's a great thing to do anyway, but it also helps make sure that your body is in the best position possible so that baby can get in the best position possible. So that's tip number one. Tip number two is to carry a pillow in the car with you. So this might sound silly, but it is really helpful. A lot of us spend a lot of time in the car, and our car seats kind of sink down. We kind of end up in a little bit of that reclined position. So put a pillow. Not a big pillow. It doesn't have to be like a bed pillow or anything like that. Actually, with both of my pregnancies, it was like a camping pillow, but I just put it behind my back so that you kind of have that extra lumbar support that encourages you to sit up straight while you're driving. So that's tip number 2. Tip number 3 is to spend time every day in a forward-leaning position. So a lot of times what makes this easiest is in the evenings, if you're watching TV, you're talking to your husband, whatever it is that you're doing. If you have an exercise ball or a birth ball, whatever you want to call it, spend some time leaning over it. And I'm going to back up and demonstrate that here in a minute, because I'm actually sitting on my ball right now. But spend some time leaning over it. This is a great opportunity to convince your partner to maybe give you a back rub or things like that. But that forward leaning, kind of modified hands and knees position will really help to bring baby forward and counteract some of that backwards sitting positions that we do so often. So I'll demonstrate that here in a minute. And then the last thing that I recommend to clients is to practice the mile circuit. And this is a series of exercises, positioning exercises, not like workout exercises, that can help optimize fetal positioning. And this isn't something that you need to go overboard on. I would say maybe try to do it once a week in your 3rd trimester. And I'll link to it in the video, and I'll show a preview of the exercises. But basically it's 3 different positions. You do each of them for 30 minutes. You go from one to the other, nothing in between. And the goal of this is to help bring the baby up where they have more space out of your pelvis, over towards the left side and forward, so that they can get in that optimal anterior position. And you do, yeah, like I said, each of them for 30 minutes. And I would say maybe do it once a week, unless you know that your baby is not in the best position and you're trying to help facilitate a change in motion. But in terms of maintenance, I would say, maybe once a week. So anyway, those are my tips. So I'll link to those positions in the videos. And yeah, I hope you have a wonderful and a healthy day and a wonderful and healthy pregnancy. Have a great day, Mama.